Yes, my name's Chad Nichols, and I serve as Executive Director of the Alabama Rural Action Commission, and it's a pleasure to be here today. I've had the distinct pleasure of working with Dr. Fouad, Dr. Partridge, Dr. Wynn, and others from UAB Minority Health Research Center and REACH over the past 6 or 7 years. And the work that they are doing to improve the community, to improve our state, is one that truly is a model, and it's something that we're blessed to have as a resource in Alabama. And so I think this dialogue is excellent. I'm an action-oriented person, and so immediately when I saw that this is a think tank that's centered on results, centered on action, I knew with Dr. Fouad and Dr. Wynn's leadership that this was going to be an unbelievable experience, and clearly it has been. I hope you've enjoyed it as much as I have. But before I talk, in a moment I'm going to talk specifically about a program that we've started. But before I do that, I'm going to give a little bit of background. I work for Governor Riley. I have for the past 7.5 years. And both of my parents grew up in Alabama's Black Belt. That's always been a passion of mine. I told the governor early on that I was very interested in working to improve the quality of life type issues in the Black Belt. That's also a passion of his, and so I've worked with helping to begin the Governor's Black Belt Action Commission, which is also fed into the Alabama Rural Action Commission. But what we've tried to do is really, the problems have been really diagnosed quite eloquently, here today, and everyone knows the problems that the Black Belt faces, the problems that our rural and urban communities face, not only in Alabama, but, across the country. And so the challenge is to not get bogged down sometimes in just the helplessness that, we can't do something. And so from a personal standpoint, I've always thought that one of the keys is to create a positive vision, to publicize results in a positive manner. Sometimes, and the Birmingham News has often done this, but many organizations across Alabama have done this. We talk about the Black Belt in terms of being similar to a third world country, things like that. Those things aren't helpful, in my opinion. It's good to understand that problems are there, but let's get beyond that. Let's roll up our sleeves. Let's get to work. Let's do something. And so with our efforts, which primarily have included improving health care access, education, economic development, one of my main emphases has been health care. And so one of the things that we do is when we create a new project, it might be working with the community, assessing needs, and they might say, hey, we need some countywide health fairs, or our youth really need soccer programs. We bring folks in to do that. So we try to be that helping hand. But I'm a firm believer that when you're dealing in communities, that they want to know that you care before they really care how much you know. And if you don't relate, if you don't listen, if you don't genuinely have an interest in helping, you can't. And so sometimes I think there's a disconnect. I think a lot of these problems, clearly, some fall back on communities. It goes back to community leadership. It goes to communities coming together and sometimes looking at what their assets are. Sometimes I think we have a tendency to harp on what our problem is, but let's build sometimes off of our assets. In rural Alabama, in the Black Belt, for example, you got some of the best land in the country. You got fishing, you've got hunting, you've got tourism capabilities that are there, and let's build off of that. And so sometimes I think communities can take that inner look. Then as state and national policy makers, we've got to be better at listening to people, because we don't have the answers. They have the answers. They live in their communities, And they'll tell you in the black belt that they don't want to look like Birmingham. They don't want to look like Atlanta. If they wanted to look like that, they would move there. And so we can't just give them a solution to everything. We have to help work with them to be part of that solution. And so that's the mindset that we've started with. And through our work, we publicized positive results. And I've seen new energy from that. New folks from the community say, hey, this is about action. This is about results. I want to get involved. So I think that's a key component. If you do something and no one knows about it, you could have done a great thing, but let's build on it. And so with that, one program that we've started, that since we're talking about answers today, I want to throw this out there as a possible answer. My personal belief is that the problems do ultimately go back to education and healthcare. I believe that if for a child to ultimately succeed, they need to stay in school. In order to help them stay in school, they need to be healthy. There's a complete parallel there. So if we've got children that aren't healthy, we've got a major problem. So with that, we've started the Kid Check program. This wasn't something that was a top-down approach. This was a bottom-up approach. But the governor created this program 2 years ago, and it's basically the way it works is we build partnerships between college nursing schools and school systems that are interested, where nursing students come in under faculty supervision and screen the children in a school day, like in a school gymnasium, head-to-toe comprehensive 10 to 12 screening station. The nursing school students receive valuable clinical hours, hands-on experience. They learn the communities. Sometimes we've got UAB School of Nursing involved. You've got Auburn, you've got Alabama, you've got a lot of two-year schools. Alabama Southern Community College, I'll kind of show you the list a little bit later on. But what we're seeing with this program is we're not only helping children, but we're helping nursing students who will ultimately be going in their workforce very quickly, and they are seeing the need for service. They're seeing the need to work together and to make a difference. So, but the rationale for the program is obviously what we've all talked about. We know that there's that link between healthcare access, healthcare outcomes, and education. Also, we know in rural, underserved Alabama that healthcare is a huge issue. We also know that health screenings through early detection, we can make a difference. It doesn't make sense to find out a problem when someone's 16 or 18 years old when they've had that problem since they were 6. We see that a lot with vision. There are children in the state that they don't know that they can't see well. They see the way they've always been able to see, and so they don't know that that's different. Well, in some cases, they might have a problem that if it's corrected when they're 5, 6, 7 years old, they're going to be fine. If it's not, they can lose vision when they're 7 or 8 years old. That's something we've got to catch early. We've got to do a better job of prevention. So that's what we're working on here. Also, Kid Check. It's a common sense. It's almost so simple you wonder why everyone isn't doing it in every state. But it's inexpensive. It makes sense. Our principles are this. The program is based on successful models. Bibb County, Blount County school systems, 2 rural Alabama school systems near Birmingham, not far away from here. They didn't call it Kid Check, but they started school-based health screenings 10 to 15 years ago. They're dramatically seeing, over those years, absenteeism decrease. They're seeing more kids stay in school. They're seeing stronger communities. They're bringing together those local businesses, those community groups, their church groups. Church groups are providing lunches for nursing students. They're building with this. So With this, we set this up. This is a locally driven program. Any superintendent in the state of Alabama that wants to implement KidCheck is free to do that, and we work along with them. Like I said, it's locally driven, but we also have strong regional and state partnerships. If you bring together your local community, we're going to bring together the state resources to also help you, whether that's helping you partner with a nursing school or whether that's helping you partner with a group like Sight Savers, UAB Minority Health Research Center, Sorrell Dental, you name it. We help bring those partnerships with state agencies, nonprofits, etc. Also, follow-up care has to be a strong component. Screening in and of itself is nice, but it doesn't get you where you need to go. So that's what we've done. We've built partnerships for follow-up care. The main problem areas that you're going to see are going to be vision, dental, and lack of health insurance. Luckily, our state is one of the leaders in the United States in providing health insurance for children. However, we can do better, and there's no reason that any child can't be insured. We've got about 5 to 6% uninsured. This is a program in place that's helping us to reduce that level. We find out through KidCheck what students are uninsured, and we're able to send home public health insurance forms. We built a partnership with Sight Savers America, which is one of the strongest nonprofits in the state of Alabama. And I want to talk briefly about, just very quickly, we've got a state vision program in place now that vision screens K2 and 4 statewide. We helped put that in place. We also helped get state funding to fund 6th grade in the Black Belt. So now in the Black Belt, since they have more issues, K2, 4, and 6 get vision screened. But what about some of those other kids? So with KidCheck, we go a step above that. And we don't duplicate the state vision program. The state vision program not only screens, but Sight Savers America coordinates all follow-up. So we've got what is considered to be probably the strongest vision program in the country right here for children. Sight Savers come to us pro bono. They said, we like the KidCheck program. If you'll screen above and beyond the state program, we will coordinate the follow-up care for free. And that's what they're doing, so that school systems can refer children failing those vision screenings, and we've seen hundreds and hundreds of free eyeglasses, eye surgeries to folks in need. Also, we have strong buy-in from Blue Cross Blue Shield's Alabama Child Caring Foundation, which is their nonprofit, Alabama Power Foundation. Those two organizations have been involved with Bibb and Blount counties, and they helped us to take that model and replicate it statewide. So I can't thank those organizations enough. And when you have those groups pulling together with local folks, with other state leaders, it's amazing what can be accomplished. And we have a wonderful KidCheck steering committee. Some of the organizations that, some of you that are from here will recognize many of them. Of course, UAB Minority Health Research Center is one of our strong partners. Kid One Transport, Sight Savers, Sorrell. We're bringing people together to make a difference. Here's a map. We've been doing KidCheck for 2 years. In the first year, we had 23 school systems interested. The second year, we had 35 implemented. We built partnerships with 23 college nursing students. So you've now got literally thousands of college nursing students that are seeing a new part of Alabama for many of them. For many of them, that might be UAB nursing students. They might be from other states. They might be from other countries. Now they're seeing parts of Alabama that maybe they haven't even been to before. For others, it's renewing an interest in their home communities. So we're continuing to build the program. So here's some of the facts. In our first year, we had about 15,000 students screened. Second year, up to over 35,000. The program has doubled. It's all based on parental consent. And what we're seeing is every year, more and more parents want their kids to be involved, whereas now in Bibb and Blount counties, about 95%, if not closer to 96, 97% of students are involved in the program. Again, the governor asked us to try to double this program from year 1 to year 2. We did that. 7 school systems in the Black Belt are now involved, and that's continuing to grow. And what they're seeing, what they're telling us is, hey, this renewed an energy in our community. We're able to bring churches together with other community groups, building partnerships with the nursing school, small businesses, local hospitals are donating or allowing equipment and supplies to be donated or borrowed. 50% of students that are going through Kid Check are on the free lunch program. An additional about 10% are on reduced lunch. We're making a difference where it needs to be. Again, the most common referrals are going to be vision, dental, weight, and blood pressure. So those are big focuses. Now, again, we've only been at this 2 years, but this program is already considered a model program. The Auburn University Montgomery Center for Government named Kid Check as the state's most innovative state regional program last year. This was, there were dozens of nominees. We were able to beat out a lot of organizations that have tens of millions of dollars, and it's just based on this simple concept that really there's not a lot of funding behind it. That's one thing that we'd like to take it to another level, but right now we've got a model in place. The model's ready to be funded. We can take this to another level. Birmingham Business Journal has called out Kid Check for the work we've done with, in healthcare advocacy. Delta Regional Authority, which represents a lot of our states on the Mississippi Delta plus Alabama, they're sharing this as a best practice with their states. National Governors Association tells us there's no other program in the country like this. It's innovative. It's something that needs to be replicated in other areas. They said there is no other program in the country where you see this type of collaboration from the grassroots level all the way to the Alabama Power and Blue Crosses of the world, building these type partnerships for screening and follow-up. So with that, one of the things that, just from my point of view, that I think, and tying this all back to economic development, Kid Check is open to any K through 12 school system. Now, a lot of ours are elementary school. We have some middle school and some high school. But part of my vision is, wouldn't it be great if one day, hopefully soon, we can say in all these rural underserved communities in the Black Belt, if we could have Kid Check in every 11th and 12th grade, these children are about to go out into the workforce. I mean, a lot of us don't necessarily think of it like that, but a lot of them are going to, hopefully graduate high school and go on to 2 or 4 year college. Some won't. Either way, let's make sure whether they're going to college or whether they're getting into the workforce that they're healthy. And that can make a huge difference in our state. So with that, I just want to thank you all very much for the opportunity, and enjoyed sharing with you about the program and some of the things we're doing here in Alabama.